What if the very medicine you trust to heal you is quietly stealing your most precious memories away? What if the pills in your cabinet, prescribed for common ailments, are contributing to a fog in your mind, a gradual dimming of the lights? Welcome, my friends. Professor Vitalis here with your daily dose of wisdom and wellness, where science and experience walk hand in hand. Today, we are embarking on a crucial investigation into the hidden dangers within our medicine cabinets. We will be discussing 8 common classes of medication that scientific research has linked to memory damage and an increased risk of dementia. I must urge you to stay with me for this entire discussion because the information we will cover towards the end is particularly vital. The 7th category of drugs on our list is one that is surprisingly common, yet its profound impact on our cognitive health is a danger that almost no one talks about. This is knowledge you cannot afford to miss. Let's begin by dismantling a very old, very damaging myth, the idea that losing your mind is a normal part of growing old. For generations, we were told that dementia and severe cognitive decline were simply inevitable tolls that time exacts upon us. But I am here to tell you that compelling recent research has shattered this fatalistic belief. The science is now clear. Memory loss is not a standard feature of aging. Conditions like dementia and Alzheimer's disease are not caused by the simple passing of years. They are the result of specific pathological disease processes in the brain. Think of it this way. Your brain is not a machine with a built-in expiration date. It is more like a garden. If left untended, exposed to toxins, and starved of nutrients, it will wither. But with proper care, with the right cultivation, it can flourish and remain vibrant throughout your entire life. This understanding is profoundly empowering. It shifts you from a position of passive acceptance to one of active, powerful prevention. We know that we can maintain and even improve our cognitive faculties as we age, provided we manage the known risk factors. A balanced diet, rich in antioxidants, consistent physical activity that boosts blood flow to the brain, and keeping our minds socially and mentally stimulated. These are the cornerstones of brain health. Managing chronic conditions like hypertension and diabetes is also non-negotiable, as they directly impact the health of the brain's intricate vascular network. But beyond these well-known factors lie others, less obvious but equally potent accelerators of cognitive decline. The abuse of substances like alcohol is a direct neurotoxin, causing demonstrable brain damage over time. Tobacco use, on the other hand, wages a war of attrition, constricting the delicate blood vessels that feed our brain cells with life-giving oxygen and nutrients. Traumatic brain injuries, whether from contact sports or unfortunate accidents, can cause not only immediate damage, but also set off a long-term cascade of inflammation and cognitive problems, a condition we now recognize as chronic traumatic encephalopathy. Similarly, a stroke, by abruptly cutting off blood circulation to a region of the brain, can cause devastating damage to the circuits responsible for memory and other cognitive functions. Even our sleep or lack thereof plays a critical role. Chronic insomnia isn't just about feeling tired, it disrupts the brain's nightly cleaning process. During deep sleep, a magnificent system clears away metabolic waste, including the very beta-amyloid proteins that form the toxic plaques found in Alzheimer's patients. Without adequate sleep, these toxins accumulate. Chronic stress is another silent enemy. It floods our system with the hormone cortisol, which, over time, can physically damage and shrink the hippocampus, our brain's primary memory center, and of course, we cannot overlook nutrition. A deficiency in key nutrients, particularly vitamin B12, can have dire consequences. Vitamin B12 is essential for maintaining the health of our nerve cells. A lack of it can lead to significant neurological symptoms, including memory loss and debilitating confusion. Psychiatric disorders, too, are deeply intertwined. Depression can cloud our concentration and memory, while chronic anxiety can fundamentally interfere with how our brain processes and stores new information. Understanding these factors is the first step. It shows us that memory loss is often a result of many contributing elements, most of which can be managed, mitigated, or avoided entirely. This brings us to the central topic of our discussion today: the common medications that can, unbeknownst to many, be one of these significant contributing factors. Let's delve into the 8 classes of drugs that can harm your memory and brain. Number 1. The hidden dangers of omeprazole and other proton pump inhibitors. Many of you will recognize omeprazole, or its cousins lansoprazole and pantoprazole. These are known as proton pump inhibitors, or PPIs, and they are widely prescribed and sold over the counter to treat acid reflux, heartburn, and stomach ulcers. They work by powerfully reducing the production of stomach acid. While they can provide immense relief, their long-term use has been linked to very serious risks for brain health. Large-scale epidemiological studies have drawn a disturbing connection between prolonged PPI use and a significantly increased risk of dementia. In one study of nearly 6,000 individuals, a staggering 10% of those taking omeprazole for a 3-year period reported experiencing memory loss. Another found that 33% of patients on the drug for over 4.5 years reported cognitive problems. How could a stomach medicine affect the brain? There are 2 primary theories. First, by reducing stomach acid, these drugs severely impair the body's ability to absorb essential nutrients from food, most notably vitamin B12. As we've discussed, B12 is absolutely vital for neurological function. A chronic deficiency can directly lead to cognitive impairment. Second, these drugs can profoundly alter the delicate balance of your gut microbiome. We are increasingly understanding the power of the gut-brain axis, a constant 2-way communication highway. An unhealthy gut can lead to systemic inflammation that directly impacts brain function. It's crucial that these medications are not used casually or indefinitely. They should follow a proper diagnosis and ideally be limited to short-term use, from 2 weeks to 3 months, while underlying dietary and lifestyle adjustments are made. Number 2. Anticholinergics, the hidden side of popular medications. Anticholinergics are a broad class of drugs used to treat a wide variety of conditions, from Parkinson's disease and overactive bladder to respiratory disorders. They work by blocking the action of acetylcholine, a critical neurotransmitter. You can think of acetylcholine as the neurotransmitter of memory and learning. It is the chemical messenger that allows our brain cells to communicate effectively, to form and retrieve memories. When you take a medication that blocks acetylcholine, you are essentially turning down the volume on your brain's ability to learn and remember. The evidence here is alarming. A major study from the University of Washington, which followed over 3,500 older adults for a decade, found that those who used anticholinergic drugs regularly had a 54% higher risk of developing dementia. That is not a small statistical blip. It is a profound warning signal. The risk increases with both the dose and the duration of use. Common culprits include medications like oxybutynin for bladder control, diphenhydramine found in many over-the-counter sleep aids and allergy pills, and bipyridine for Parkinson's. If you are taking such a medication, it is imperative to weigh the benefits against these serious cognitive risks with your doctor and actively seek alternatives with a lower anticholinergic burden. Number 3. Corticosteroids in the brain. Potent medications like prednisone and dexamethasone are lifesavers for people with severe allergies, asthma, and autoimmune diseases. They work by powerfully suppressing inflammation. However, when used for long periods, especially in oral form, they can have serious consequences for mental and cognitive health. Research has shown that long-term corticosteroid use can lead to structural changes in the brain, manifesting as disorientation, anxiety, depression, and confusion. How? These drugs mimic cortisol, our body's primary stress hormone. And when you are exposed to high levels of these synthetic hormones for an extended time, it's like putting your brain in a state of chronic, high-intensity stress. This can be toxic to the neurons in the hippocampus, that all-important memory region. A large British study found that people taking long-term corticosteroids for asthma had a significantly increased risk of dementia. Even inhaled forms like fluticasone can have negative effects at high doses over time. These medications are often necessary, but their use must be carefully monitored. The goal should always be to use the lowest effective dose for the shortest possible time, while exploring non-pharmacological strategies to manage the underlying condition. Number 4. Benzodiazepines, a silent risk for memory. Benzodiazepines, a class that includes drugs like alprazolam and diazepam, are widely prescribed for anxiety and insomnia. They are famous for their immediate calming effects. But this rapid relief comes at a steep price, especially with long-term use. The link is clear. Prolonged benzodiazepine use can double the risk of developing Alzheimer's disease, possibly by causing permanent changes in the brain. These drugs work by enhancing the effect of a neurotransmitter that dampens brain activity, which is why they feel relaxing. However, this sedation interferes directly with the process of memory consolidation, much of which happens during sleep. Furthermore, a staggering 40% of long-term users report a constellation of neurological symptoms, including a persistent lack of energy, nervousness, and a debilitating difficulty with concentration. Beyond the memory loss, there's a very high risk of physical and emotional dependence, creating a vicious cycle where it becomes incredibly difficult to stop the medication, even as the negative effects mount. Given these severe risks, non-drug therapies like cognitive behavioral therapy and relaxation techniques should always be the first line of treatment for anxiety and insomnia. Number 5. Amphetamines and the memory trap. Amphetamines are the go-to treatment for attention deficit hyperactivity disorder, ADHD. They are well known for their short-term ability to improve focus and reduce hyperactivity. They work by boosting the levels of stimulating neurotransmitters like dopamine and norepinephrine. While they can be effective, they carry a high potential for addiction and can lead to significant memory loss with long-term use. Think of it like constantly redlining a car's engine. The continuous artificial stimulation can, over time, lead to a burnout of the brain's natural neurotransmitter systems. Studies show that high-dose, long-term use can cause lasting damage. Users may experience not just memory problems, but also a decline in motivation and overall cognitive performance, effects that can persist even after the drug is stopped. The potential for abuse is also a major concern, as people misuse them for their stimulant effects, leading to severe health complications. The treatment of ADHD should always be multifaceted, incorporating behavioral therapies and stress management techniques to minimize reliance on these powerful medications. Number 6. First-generation antihistamines. Relief today, problems tomorrow. Many people reach for first-generation antihistamines like diphenhydramine and chlorpheniramine to treat allergy symptoms or a common cold. They are effective at stopping the sniffles and itchiness, but they have a dark side. Over time, they can have a significant negative impact on memory and cognitive function. The reason for this goes back to our discussion on anticholinergics. These older antihistamines work not only by blocking histamine, but also by strongly blocking our friend acetylcholine, the memory neurotransmitter. A comprehensive review of 138 scientific articles found a clear association between the long-term use of these drugs and cognitive decline. Many patients who use them regularly report memory issues and brain fog that can linger even after they stop taking them. The good news is that there are much safer alternatives. Second-generation antihistamines like cetirizine and loratadine do not have these same anticholinergic effects and do not pose the same risks to brain health, making them the preferred choice for long-term allergy management. Number 7. Tricyclic antidepressants and memory loss. This brings us to the class of drugs I warned you about. Tricyclic antidepressants, such as amitriptyline and nortriptyline, were among the very first medications developed to treat depression. While effective, they are notorious for their side effects, including significant memory loss and other cognitive problems. These drugs work by increasing the availability of several neurotransmitters, but they also have a powerful, messy side effect. They are potent anticholinergics. They block acetylcholine with tremendous force. This is why they are so strongly associated with an increased risk of dementia and cognitive decline, especially in older adults who are already more sensitive to these effects. Patients on these drugs often report confusion, difficulty concentrating, and both short-term and long-term memory loss. Thankfully, in modern medicine, we have much safer alternatives. Selective serotonin reuptake inhibitors, or SSRIs, like sertraline and fluoxetine, are now the standard of care. They are more targeted in their action and do not carry the same heavy burden of cognitive side effects. If you or a loved one is taking an older tricyclic antidepressant, it is absolutely essential to have a conversation with your doctor about the possibility of switching to a newer, safer option. Number 8. Statins and cognitive function. Finally, we come to statins like simvastatin and atorvastatin. These are some of the most widely prescribed drugs in the world, used to lower cholesterol and prevent cardiovascular diseases like heart attacks and strokes. They are undoubtedly life-saving medications. However, a growing body of evidence suggests that for some individuals, their use can lead to undesirable cognitive effects. Some users of statins report experiencing memory problems and a sense of mental fogginess. The theory is that while cholesterol is harmful in our arteries, it is absolutely essential in the brain. The brain needs cholesterol to build and maintain healthy synapses, the connections between neurons that form the basis of all thought and memory. By lowering cholesterol production throughout the body, statins may inadvertently be depriving the brain of a key building block. The research is still mixed, with some studies even suggesting a protective effect against dementia. However, the reports of cognitive side effects are real, and it's essential that patients and doctors are aware of this possibility. If you are on a statin and notice cognitive changes, it warrants a serious discussion with your physician about potentially changing the type of statin or adjusting the dose. The overarching lesson here is that self-medication, or even the passive acceptance of long-term prescriptions without question, can have a profoundly negative impact on your memory and cognitive function. From something as common as an acid reflux pill to older forms of antidepressants, the potential for harm is real. It is vital that you have informed, open discussions with your healthcare provider about the risks and benefits of any medication, and always be willing to explore safer alternatives to protect your long-term cognitive health. Knowledge only works when you apply it. I'm Professor Vitalis. Stay curious, stay healthy, and never stop learning.